Co-director of the Cornell University Wildlife Health Lab. They're another key partner and another key piece of the puzzle in managing CWD across New York State. As such, Krysten and her team have provided key scientific insight into the best practices for disease prevention and, just as importantly, have served as our hub for surveillance operations here in New York State. Dr. Schuler.
So I grew up along the border of New York and Pennsylvania, so this feels a little bit like a homecoming for me. I've also been studying chronic wasting disease for my doctoral research since 2002, so this disease is as near and dear to my heart as you actually want a disease to be. I personally have seen animals succumb to this disease and know how serious it is and what the consequences can be for those people in states that have had the disease, like Wyoming, South Dakota, Wisconsin, and how serious it can impact not only their recreation, but their traditions and their way of life. So looking at CWD across the spectrum of potential wildlife diseases, it is a very serious threat. It's universally fatal. Animals become infected and die a very slow death, which usually takes more than a year. Unfortunately, the science on this disease keeps getting worse, and we always look at science to have breakthroughs and give us hope, but in this situation, we haven't been able to develop a vaccine. It's not a virus, it's not a bacteria that we have antibiotics for. This is a new class of disease that's caused by a prion, which is an abnormal protein particle. And when we talk about prion diseases, the ability of them to infect animals over a long term, those animals then shed prions in their saliva, feces, and urine to the point where the environment becomes contaminated. So even if you remove those animals from the landscape, you're not actually able to remove the disease itself. And it's ironic that for those of us like my colleague, Dr. Elizabeth Bunting, we dedicate our careers to keeping wildlife healthy. And with this disease, we have to kill the host animal, the deer, the moose, the elk, the reindeer, that could potentially get infected in order to stop it. And this isn't what we want, it isn't what the public wants. So by taking a look at all the risks that are out there for potential introduction and spread of chronic wasting disease and looking at those in a very comprehensive way, this CWD risk minimization plan addresses those risks, and it does it in a very proactive way, which is something that is unique, and New York is definitely the leader in the nation in taking these proactive steps. We don't want to be like Wisconsin, where they're seeing prevalence rates of 50% in some of these heavily infected counties, where you have a 50-50 shot of shooting a trophy buck that's infected with CWD. So states like Wyoming, where they've had the disease since 1978, are seeing 10% annual population declines. And it's this population decline that's really gotten the attention now of other states and really ups the seriousness of the disease. We've been looking for chronic wasting disease in New York State in a very comprehensive way. We use a risk-based weighted surveillance program where we identify where the highest risks are. We're looking at the most likely animals that will have the disease, as well as the areas where we're most likely to find the disease first. So a lot of that's along the southern tier of Pennsylvania. Now, we've said already that the best defense is a good offense, and with this, we're being proactive. We're taking these cost-effective measures that will hopefully save New York taxpayer money that we won't have to put towards a disease response. CWD responses cost the state millions of dollars. They impact hunters and the public, and most seriously impact our wildlife resources. So there's not usually a lot of good news around CWD, but today is the most hopeful that I've felt about anybody's ability to stop CWD, and I really commend these two agencies on taking the steps necessary to combat it, and I'm very grateful that Cornell University was able to be a part of that.